irog ka. Hi, my name is Sal Manalo. I am 22, currently studying first year college. Dahil sa'yo. Actually, nirefer ako dito nung friend ko. And may gusto din kasi akong pa-enhance sa face ko. To be specific yung nose ko. Ngiti ko'y abot langit pag ika'y nasa aking tabi. Don't forget to click the subscribe button and click the notification bell for you guys to be updated.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a first-time guest. Actually, he had been here a couple of weeks ago for a facial treatment and like anti-acne. All right. So let's all welcome for the first time Sam Manalo.
Hello po.
Hi, Sam. So, you had the Synergy Anti-Acne Facial. Of course, young people like Sam. Okay, how young are you?
22 po.
Yeah. See, very young. Of course, they still experience this acne, pimples, enlarged pores, oiliness. Okay? And looking at Sam, okay, dahil batang-bata ka pa, you still experience this. And I was sharing with him, it's the hormone, your biologically active hormone, dihydrotestosterone, stimulating all those sebaceous glands. Actually, we'll be doing a treatment for some on that problem. But that is not our procedure for today, okay? And I'm also doing a face assessment for some, okay? He's young, early 20s, okay? For this, of course, this age, it's not an anti-aging treatment.
Yeah.
It's enhancing and, of course, highlighting those beautiful parts of the face. The center, key attraction point of our face. Ano ba yung nasa center? Well, nose, okay. Well, the others, we do enhancement like eye area, cheek areas, the chin area, okay. But for now, we'll be working on the center, the nose, okay. So, the nose can give balance between the upper and lower third of our face, okay? So when we do nose enhancement, we just want to make it within that ratios and proportions. So we have mathematical formula when we're doing treatments like this. So our nose being at the middle part, so horizontally, the middle, and also vertically, the center, vertical fifth of the face. So we want to follow certain measurements, like for example, the height, the width, angles, rotations. So a while ago, I was doing like a measurements on the nose of Sam, okay? Sabi ko nga sa kanya, parang we also have like architecture part of our, you know, aesthetic procedures. We want to follow certain dimensions and measurements, okay? So for some, we just want to also improve the radix height here, the radix projection. We have the frontonasal angle. Actually, the nose of Sam is already okay. Tama? Yeah. Right. And it made him look really, ayan, attractive also. Okay? Very attractive na itong batang to. So, the radix, we can still do like a bit of a projection. Actually, the nose also over time will age. Have you heard of that? So the nose also, like the soft tissues there will kind of what we call that, atrophy or nagsishrink. Even the skin over time, makikita mo the others have wrinkles, bunny lines, and then the others, like over time, it will drop down. So it sags down, okay? But for some, we're just enhancing. So we want to improve the projection, improve the frontonasal angle, and somehow follow the intercanthal width. and also improve this angle here. Ideally, for men, we want the nasolabial 90 degrees. Okay? So, it's just like, yun nga, enhancement.
Yeah.
Okay? And will not change your face. Will not alter your look.
Yeah.
It's still gonna be Sam, okay? Baka pagalitan ako ng parents mo when you go home, okay? And then actually, I was also doing an assessment on the entire face. For men, we want like a lower third dominance there. I was checking on I was telling him, baby face ka pa, yung mga baby fats, yan. So, in the future, we'll also be doing like a masculinization of the lower third of the face. So, what kind of treatment, what procedure will show you when CSA Medical Aesthetics return. And we're back. So, we'll be working on the nose part. Okay, so we want to improve the radix projection, somehow elongate the nose, and then narrow the alar width, and also improve the nasolabial angle. We want the 90-degree angle, okay? So for our nose procedure, a non-surgical one, we'll be using a combination of our hyaluronic substance together with our PDO polydioxanone threads. Then, so we'll start with anesthetizing the entry point here, the tip of the nose, okay, just a tiny prick there. And then we'll use a gauge 19 needle. Okay, you're good, Sam? Okay. Yeah. We'll use this gauge 19 needle to create that opening, tiny opening. And I have my gauge 22 cannula. I'll be using this type of hyaluronic filler here and glide this in the layer 4 of the nose area. Just pressure some, okay?
Yes.
So push a little bit. The hyaluronic substance has a lidocaine with it, so somehow it will help reduce any discomfort. Okay, so I'll be reaching the so-called radix part here and infusing a little bit of my material there. Okay, just a push there, gradually. Okay, then I can already also direct this towards the columella. Okay, and in the columella, we want to reach the so-called anterior nasal spine. Sorry for that, just some pressure. Okay, so this one we want to reach the base of the columella there. There you go. So I have my polydioxanone threads here, inserting in the midline layer 4 of the nose. Then I'll just be using several of these PDO threads. Okay, so pinching the nose, pulling up like that, and directing it in the layer 4. So series of protein polydioxanone threads. These are polymers of dioxanones, and these are absorbable type of suture threads, but these are beneficial because they will stimulate collagen tissue formation. It's like building up your new connective tissue proteins there. So we'll proceed with the so-called tip columella projection. So I'll be using the shorter version of those threads, PDO threads, and direct it into the columellar space up to the anterior nasal spine. Okay, some discomfort in the base area whenever we're reaching the so-called ANS, a bony area. And as expected, we can place like around 2 to 3 of this just to improve the height, the nasal tip height. Okay, and actually we're done with the procedure. We'll show the result to Sam when CSA Medical Aesthetics return. And we're back, so let's now show the result to Sam. Sam, here's the mirror. First time po niyang makikita. Hawakan mo na. Yan. So, we did nose radix projection and also the so-called nose tip lift. And somehow we want to narrow the sides of the nose. So we will still do a so-called alar tucks here, and we'll also help with the reduction of the fat tissues on the nose tip as well as on the sides, the alar area, okay? So we wanted the radix height to be within that right measurement, the right dimension there. And looking at the profile view of Sam right now, I like the projection of the nose. Actually, some that will still kind of, subside because it was just injected right now. It's newly inserted. The products were just placed. It will still blend. It will still integrate. It will still merge with your nose tissues. So you'll still have this gradual, like it will still go down a bit. Okay? So magano pa yan? Magsusubside pa yan. Okay? Any comment, Sam, so far?
Masaya po ako.
Yeah, so far so good, right? How was the procedure? Was it painful?
No, actually
Not really.
Parang hindi po ganun ang in-expect ko. Kasi parang super, feeling ko na parang di pa tayo nag-uumpisa.
Really?
Kasi wala po akong na-feel na pain at all, like yung super pain na pain.
Yeah, because most of our patients, that's the concern. Like if they're watching our video demonstrations, they were saying that looks painful, but you've heard it from some na it's a procedure that it's actually we did the lidocaine injection at first, but you felt that, di ba? The sting from the lido. But after that, it was already numb.
Yeah, wala.
Yeah. So it was, I could say, during the insertion of the hyaluronic plus the PDO threads, it was really painless.
Yeah,
okay?
Wala.
Yeah. Right now, it's normal to feel some pressure or some
Mabigat.
heaviness.
Yeah.
That's expected because we place like product materials. We have a high G prime hyaluronic molecule there, and we have those polydioxanone thick threads inserted in the bridge as well as into the tip columella, this columella of the nose. Now, you'll just be feeling some, like in the upper gum area, some discomfort there. It's normal at first. Eventually, it's gonna go away. Okay. Parang nagpa-brace ng ngipin. Na at first, you feel the braces. And then, same thing here when we place those threads, PDO threads, because they're stiff also. So, you will feel some on the upper gum. Yeah, parang there's something there, the tip of the thread, you feel it, you sense it in your upper gingiva. That's expected, and it's gonna go away like few days only. It's gonna be okay na, okay? So, how do you like the new, like the profile view, frontal view? What do you think, Sam?
Sobrang goods po.
Yeah, right?
Parang feeling ko mas confident ako.
Right.
When nagpo-perform.
Yeah.
Thank you po.
So happy for you, Sam.
Thank
Actually,
you
you're a singer, you're a vocalist,
Yeah.
you're an artist. Yeah, artist. Okay. Anong group nyo?
I'm part of a band called Barabas.
Yeah.
And we are, nakasign po kami sa Viva Records ngayon.
Okay. Wow. So happy for you, Sam.
Thank you po.
Congratulations on that. God is good. He has blessed you with beautiful voice.
Thank you po. Thank you po.
Right. So actually, we will still be doing a treatment for Sam. I explained to him that we'll be working on also the sebaceous glands on the nose area. We want to shrink it at the same time. Plus, we do some of the fat pads on the nose tip and on the alar areas, okay? Because we Filipinos, we Asians have thicker fat tissue sa ating nose. That's why it's rounded, okay? And in the future, we'll be working on this part of yan, isang yan. So, we'll still have a project, a masculinization, okay? And of course, we wanted to improve the skin texture, the enlarged pores. We want to also treat the comedones, okay? So, we'll be prescribing you some medicines, okay? Thank you so much, Sam.
Thank you po.
Yeah, we'll still have Sam with us. Aawitan pa po niya tayo. Okay?
Yeah.
So, if you have any questions, you may email us at csaskinclinic@yahoo.com, our Instagram, CSA Medical Aesthetics, and email address, csaskinclinic@yahoo.com or csamedicalaesthetics@gmail.com. Also, our videos, please keep watching them. We have like series of new episodes. So, like, as much as possible, we want to try it every week, okay? So just go at our YouTube channel, Contessa Salvador, and please do subscribe. And of course, thank you sa lahat na po ng mga nag-subscribe. So God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.